Ladies and gentlemen, please welcome APMA President Dr. Joseph Caparuso.
Thank you very much. Welcome to the 2012 Annual Scientific Meeting. What a great meeting, no? This meeting will be unlike any other APMA event you've ever attended. Not only is our scientific program the most medically advanced it's ever been, and our exhibit hall completely sold out, but as you just saw in the videos, we are celebrating a 100-year anniversary of podiatric medicine. In July 1912, 225 members gathered to organize a national association dedicated to the needs of practicing chiropodists. Today, what they started has become the premier association for more than 12,000 podiatrists, physicians, surgeons, and specialists of the foot and ankle. We are today's podiatrists, and we'll continue this long and proud history of podiatric medicine. I'm honored to serve as APMA President during this historic time in our profession and officially welcome you to the National today in our nation's capital. I hope the next few days are both educational and celebratory for you all. We start this 100-year anniversary celebration with a very special guest. I'm honored to introduce Dr. Regina M. Benjamin, the 18th Surgeon General of the United States. That's good, Colin. As our opening session speaker today, as America's doctor, she provides the public with the best scientific information available about how to improve their health and the health of our nation. Dr. Benjamin also oversees the operational command of 6,500 uniformed public health officials who serve in locations around the world to promote and protect the health of the American people. Dr. Benjamin is the founder of a rural health clinic in Alabama, which she kept in operation despite damage and destruction inflicted by 2 hurricanes, Georges and Katrina, and a devastating fire in 2006. Today, she's a leader in the worldwide advancement of preventive health care. Dr. Benjamin has forged a career that has been recognized by a broad spectrum of organizations and publications. Dr. Benjamin has a BS in chemistry from Xavier University in New Orleans, an MD from the University of Alabama in Birmingham, and an MBA from Tulane University. She attended Morehouse School of Medicine and completed her family practice residency in Macon, Georgia. Dr. Benjamin holds 18 honorary degrees. Please help me welcome U.S. Surgeon General Regina Benjamin. Thank you so much.
Thank you very much. Wow, good morning. The lights are kind of bright, so it's hard to see you back there, but I can see a lot of people, lots of people. Thank you, Dr. Caparuso. It's really wonderful to be here with you today at the largest gathering of podiatrists in the world. That says a lot. I have one job I have to do before I start talking to you, and that is this. On behalf of President Obama and the entire administration, congratulations on the 100th year of the profession of podiatric medicine. You really do have a lot to be proud of. The APMA has been committed to maintaining the integrity and the quality of the extensive education and training that podiatrists receive. And this has led to the success of the profession of the podiatric medicine. So you really do have a lot to be proud of. I was talking with some of the board members earlier, and I realized I wanted to share with you just how I got involved, because many of you here are here for the same reasons. When I was an intern, I attended the Medical Association of Georgia's annual meeting. And one of the intense issues that was being debated was that sexually transmitted diseases needed to be taught in medical school. Well, I stood up in a room with maybe 15 people or so, and I said I'd never seen certain diseases except in a textbook. The resolution passed, and the Georgia delegation forwarded that resolution to the American Medical Association. And they sent me to the AMA to speak to the resolution, and it also passed. And within 6 months, every medical school in this country was encouraged to include sexually transmitted diseases as part of their core curriculum. I learned that one person can make a difference, whether it's in medical policy or in medical practice. And I learned that I could make a difference in medical practice when the National Health Service Corps sent me to Biola Battery. It's a pretty place, but it's a poor place. I found a community of working poor, too poor to afford medical care, but too rich to qualify for Medicaid. I liked the people, I liked the community, and I wanted to practice medicine there. But I quickly learned that practicing medicine wasn't just sewing up the shark bites. I had to deal with the land sharks, the regulators, the reviewers, the red tape, all the paper and the things that we go through. But I also learned that my prescription pad wasn't enough. My patients had problems that went beyond that. For example, I had a patient, Donna, who had seizures, and for a long time, her seizures were under control. But she came in and she said, I started having seizures again. And I asked her, did you miss your medicines or what? And she says, no. But she took out a piece of paper and she drew for me, because I asked patients to write down things for me. And she said, Jim, our pharmacist, used to give her these pills that used to be a solid, and one was a stripe. Now she gets 2 stripes. And I realized that Donna, who was in her 20s, could not read. And no matter what I did, I had to find some sort of services to help her read if it was just as important as keeping her blood pressure under control. And another patient that's Miss Smith, that's her HIPAA name, by the way. She called me on a Saturday, and because like many of you, patients need you on a weekend, they call you, and then they don't abuse it. So she called me and she says, Dr. Benjamin, my back is really, really hurting. I went to that specialist you sent me to, and he told me I needed to lose weight. And I'm really trying, but my back is really hurting, and the ibuprofen's not strong enough. Can you call me in something stronger? And I said, sure. I could hear the pain in her voice. I said, but Ms. Smith, you need to come and see me on Monday or Tuesday. I'm going to call your prescription in, but you need to come and see me. She said, sure, I'll be there. So sure enough, on Tuesday, I walked in the exam room, and there she was, leaning over the exam table in so much pain that she couldn't sit down. I said, Ms. Smith, did the medicine I call you in, did it help at all? She says, well, Dr. Benjamin, I didn't get it. What do you mean you didn't get it? She says, I didn't have the money. I said, but you have insurance. You work at the school system. In the janitorial department, you have insurance. She says, yes, but I didn't have the copay. But I get paid on Friday, and I promise you I'll get it. And so I stepped out of the room, and I went to my nurse, Nell, and had her go across the street to Jim to get her medicines. And when I came back, and I went in the room, and I said, Miss Smith, here's your medicine. I can see you're really hurting, and, I want you to start taking your medicine. And at that moment, her eyes welled up with tears. And she says, oh, Dr. Benjamin, I'm so embarrassed. I didn't want you to have to do that. And I realized at that moment, I had taken her dignity. And I also realized that, by the way, I didn't tell you, she's like 5'4", African-American lady, really sweet lady about that tall. I realized at that moment, though, that the fact that I had taken her dignity from her, that cultural competency has nothing to do with the color of your skin. It has to do with allowing people to keep their dignity. And so I had to figure out how to get out of that. So I told her the fact that, you know, we had few people would send us a small pot of money. They would send us donations for and we call it our medication fund, just for people like her. And if she wanted to pay it back when she got paid on Friday, she could, but she didn't have to. And she was okay with that. And so as I was leaving the room, many of you know this, she says, "Oh, by the way." And her "oh, by the way" was, "Can I get a work excuse?" I said, "Sure, you can get a work excuse." I said, "Today is Tuesday. Start taking your medicine. You want to go back to work on Thursday or Friday?" And she says, "Oh, no. We have to strip the wax off those floors tonight. I have to go back tonight." Here is a woman who is in so much pain she can't even sit down in the exam room, but she's willing to strip the wax off the floors so our kids could go to school in a clean environment. So it was for people like her that I was willing to come and take this job, so I could be a voice for her. And so it was so gratifying for me when the Affordable Care Act passed and preventive health services are now required by insurance companies, and they're also required with no copay. So I call that my Mrs. Smith's law. You know, one of the most important aspects of foot care that you do as a podiatrist and that you provide is to those with diabetes, including today's podiatrist in the diabetic management as part of the team is a vital step in preventing ulcers and amputations. I have been a long-time champion of the power of prevention, and it's the foundation of my work as Surgeon General. You know, health does not occur in the doctor's office and the hospitals alone. Health also occurs where we live, where we learn, where we work, where we play, where we pray. I believe that prevention offers the greatest opportunity to improve the health of America's families now and for decades to come. I also believe that prevention is the key to building a stronger and more sustainable healthcare system. And prevention is not new to the national dialogue. However, in recent years, it's become more vital and more relevant than ever before. It's become an imperative. And that's largely due to the changing dynamics and the demographics as more American families struggle to deal with the chronic illnesses such as diabetes and hypertension and cardiovascular disease, impacting people of all ages, ethnicities, and economic strata. And the case for focusing more of the nation's attention and resources on prevention is more than a theory. It's a reality that's grounded in science and experience. We know that with better health, children attend school more regularly and they're better able to learn. We know that with better health, adults are more productive at work and they work more days. And with better health, seniors can better maintain their independence. On the other hand, we know that the lack of prevention takes a devastating toll on patients, their families, their communities, and the workplace. You know, it's interesting that much of the illness and the early death that's related to chronic diseases is caused by just 4 modifiable risk behaviors: the lack of physical activity, poor nutrition, tobacco use, and excessive alcohol consumption. Almost 50% of adults have at least one chronic condition. This year, in 2012, more than 800,000 Americans will die from heart disease, and the overall cost resulting from cardiovascular disease is estimated to be $444 billion each year. And diabetes is a major cause of heart disease and stroke. 26 million Americans have diabetes, and 7 million of them don't even know they have it. And diabetes is the leading cause of kidney failure, non-traumatic lower limb amputations, and new cases of blindness among adults in the United States. Type 2 diabetes is an emerging health problem in youth, particularly minority youth, being driven by our obesity epidemic. And I've got some more statistics for you. According to CDC, if the current trends continue, as many as 1 in 3 U.S. adults could have diabetes by the year 2050. And up to 25% of those with diabetes will develop foot ulcer. And more than half of all foot ulcers will become infected, requiring hospitalization, and 1 in 5 of them will require amputation. And also, people with a history of diabetic foot ulcer are 40% more likely to die in 10 years than people who have diabetes alone. So it's so important that quality podiatric care must continue to advance. By preventing amputations and hospitalizations, podiatrists not only save lives and limbs and healthcare dollars, they also help patients preserve their dignity and their quality of life. We have to make prevention part of our everyday lives and empower people to make better health choices. So I'm pleased that the Obama administration has launched a broad agenda to help Americans get healthy, live longer, stay well, and thrive. As Surgeon General, I have the privilege of chairing the National Prevention, Health Promotion, and Public Health Council that was established by the Affordable Health Care Act, also known as health reform. This council is composed of 17 cabinet-level heads of federal agencies, such as Department of Transportation, Agriculture, Labor, Environmental Protection Agency, HUD, Department of Defense, all 17 coming around the table to talk about prevention. And last year, the council released the first ever national prevention strategy. Let's see, I think there's next slide, if you got some slides for me. Yeah. So the National Prevention Strategy was released last year, and our vision is to move our healthcare system from a focus on sickness and disease to a focus on wellness and prevention. If we truly want to reform healthcare in this country, we need to prevent people from getting sick in the first place, to stop the disease and stop the illness before it ever starts. So in addition to the state-of-the-art medicine, we need a new approach to promoting prevention in our communities, since staying healthy depends on other factors that influence our health, like housing and transportation, education, the availability of quality, affordable foods, our workplace, and our environments. We want to change the way we think about health in this country, and that calls for the nation to take a more holistic and an integrative approach to community health, something that you've already been doing. We need to do that as a nation. Everything from safe highways and worksite wellness programs to healthy foods and good schools, good roads. Now I'm going to figure out how to work the slides. There we go. So the goal of the National Prevention Strategy is to increase the number of Americans who are healthy at every stage of life. You know, whether you're 2 or 92, we want you to be healthy. It's like one of my patients said, you know, I want to get old, but I want to be upright. So we have 4 pillars: healthy and safe communities, clinical and community preventive services, empowered people, and elimination of health disparities. And I know that you've been working on all of these things, and we just need to put them all together. If we follow the recommendations, and we have several of what we call our priority areas around there, as you can read them. But if we follow the recommendations of the National Prevention Strategy, we can prevent or at least significantly reduce the 5 leading causes of death. So we've been working with partners like you, as well as partners in industry and corporations, education and philanthropy, local and state and tribal governments, to bring this National Prevention Strategy to life. You know, we need to have a North Star, a place to follow in, and this strategy kind of puts that together. It gives us a direction to go, and it's available to you at our website, surgeongeneral.gov, if you want to look at it, and we'll come out to your community and talk to you a lot more about it. But the biggest challenge that we've seen has been in lifestyle changes. But lifestyle changes is what can make the biggest difference. As leaders, we can make being healthy fun. We can make health behavior joyful. We have to put the joy back into health. You don't see it anymore. There's no joy for the individuals. The health professionals don't have the joy. We have to find our own joy. You can't underestimate how important it is to have joy in healthcare. You have to find your own joy. What brings me joy in healthcare may be different from your joy. Maybe one person wants to run a marathon. For whatever reason, they might want to run a marathon. Another person's joy, health joy, may be to fit in an old pair of jeans. And yet another one's may just be to sit up long enough to play with the grandkids that evening. Whatever your healthcare joy is, we, particularly in government, want to help you get there. Once you identify what it is for you, our road is to make it easier and affordable to get there. We have to stop telling people what they can't do, what they can't have, and start to tell them what they can do. And so I call this my Surgeon General's journey to joy. We started doing things whenever I do talks. I do some walks and activities, and walking is something I think you know a little bit about, and we want to make sure that we promote walking. I actually wanted to walk at this conference afterwards, but I have to catch a flight, so you get out of it this time, but not next time. So let's see, we walked in North Carolina in American Tobacco Trail. It was back in North Carolina. I had a meeting, and I said, anybody who wants to walk with us, kind of show up tonight after the meeting, which was about 5 o'clock. It was the wintertime, so it was at night. And it's a really nice trail. We had a couple of hundred people from the community who came and walked with us with their babies, their kids, and their strollers, and their dogs. And it's just a lot of fun. We walked. We also do Zumba. Any kind of activity, dance, walk, whatever. We did a walk in Boston, white coats and white sneakers with the physicians in the area. So just walking. So we were going to do that with you. So you will do it next time, or we'll come out in your community if you invite us. But basically, have fun. Enjoy doing what you're doing, making it fun with the family, with everyone. I did another walk, which I don't really call a walk. I don't know what I call it, but it was the Grand Canyon. It was 26.2 miles, 3,000 feet down, 3,000 feet back up. And it was a challenge, but it was fun. And it was being out there, being in the community, I mean, not in the community, but in the Grand Canyon. Some parts was woods, but most of it wasn't. And it wouldn't have been so difficult except I had cameras following me the whole way. And it's like, you're huffing and puffing in cameras. But the point is, if I can do it, anybody can do it. So that was the whole idea. But walking and enjoying, making healthcare fun. And people, when you ask them why they don't walk, oftentimes they say their feet hurt. So we're looking to you to make sure that you can help them with that, and that not be a reason not to walk. Or if you're walking poorly, encourage people to walk, and you can do that with your patients for us. Another thing is the dance breaks. I showed you we do Zumba, and you certainly need your feet to dance. So it doesn't take a lot, you just dance. We're asking some of the radio stations to help us with what I'm calling 30 to 60-second dance break. They play music, and you just stop what you're doing and dance in place. And, change one day it may be rock and roll, another day soul, another day country, but just stop what you're doing, and if you're driving, just dance. Yeah, just move. You may not burn a lot of calories, but it's very good mental health, and the idea is to have fun. Before I stop, I want to tell you about one other area that I'm certainly interested in, and every other Surgeon General has been, and I need your help with that too, and that's smoking. And you know that smoking really affects the peripheral circulation. But we just released a Surgeon General's report this spring on smoking in youth and young adults. Every single day, 1,200 Americans die from smoking. And each of those deaths is being replaced by 2 young smokers. We call them replacement smokers. 90% of all smokers start by the age, they start by the age of 18, 99% by the age of 26. And the Surgeon General's report, by the way, is 800 pages, 136 scientists went into putting it together. So everything I say about it has to be scientifically factual. Over $1 million an hour is being marketed on tobacco and tobacco products. It's $27 million a day. If we can just get our next generation not to take their first cigarette before the age of 26, we can make that next generation tobacco-free. So it's real important that we look at our young kids, particularly our college-age kids. They're the ones who are starting to pick it up. We've made wonderful strides in smoking, but this is an area that we still have a ways to go. I hope you'll follow me on Twitter at SG Regina and our Journey to Joy. I want to particularly commend you for the important healthcare services that you provide to millions of Americans every day. As America's doctor, I want to tell you, though, we need you, and therefore we need you to take care of your own health. I'm going to be getting on a plane in a little bit, and that flight attendant says, put on your own face mask before attempting to help others. We need you to put your face mask on. We need you to do your own exercising, take your flu shots, do the things that we need to show examples. Make sure you take care of yourself, exercise, eat right, and get enough sleep. And finally, I want to end with a quick story, and that is there was a young girl who was jogging along the beach early one morning. She was jogging along the beach early one morning, and as she was jogging, there was an older gentleman tossing these starfish in the water, one at a time. And as she was doing her run, he was tossing the starfish in the water. And when she finished her run, she just couldn't take it anymore, so she went up to him and she says, "Why are you bothering to toss the starfish in the water one at a time? There are hundreds and hundreds of starfish along the beach. As soon as the sun comes up, they're going to dry out and die anyway, and it's not going to make a difference. Why do you bother?" He reached down, picked up a starfish and said, "Because it makes a difference to this starfish." And he tossed it in the water. I hope that this next few days, as you attend this conference and learn as much as you can, that you go back home and you find your starfish and that you continue to make a difference. Thank you so much, and congratulations on 100 years of podiatric advancement.
U.S. Surgeon General Regina